I hope all of you got the emails. We have hashtags we want to share. Post the session. We're going to share all of the links and updates that we have. And so to give a brief context on who we are and what we are trying to do here, Kaarana as a group came together post the Aarogya crisis at some levels with a lot of issues around its security. There are a bunch of independent technologists who came to look at government technology, and they're continuing to do that. We have done a similar event in the past on internet shutdowns in Delhi on how to address technological solutions to internet shutdowns, not necessarily legal aspects of it. So in today's sessions, we want to explain some of our analysis from some of the technologists who have actually tried to analyze how the Aarogya Setu app has been working, and also other apps which are similar in nature. Before I let Riddhi talk about her analysis, I'm going to briefly introduce you in the context of epidemics and epidemiology, epidemics and epidemic responses that have taken place in the world. What we have seen so far in the world, or the idea of epidemiology as a science, evolved post John Snow's map of latent cholera instances in Soho, London, where Dr. John Snow, he made a map of all cholera-affected patients, and he was able to use data to identify that cholera was spreading through water pumps. This is the start of epidemiology, and data has always been used, data or statistics has always been used to solve epidemics. What we are witnessing right now, though, is, sorry, there is some noise. Can someone mute themselves? So what we are witnessing right now for an epidemic crisis is we are witnessing a lot of technologists who are trying to provide answers. But unfortunately, it's not being led by healthcare people. In the case of Dr. John Snow and all the plotting of individuals, it was being done by a health practitioner.
I think we have lost Srikanth.
We are trying to understand.
Okay, sorry. Sorry. That's mine.
Okay, I'm gonna. I think it's better. So what we have seen during the cholera outbreak is essentially a doctor trying to use statistics and respond to it. So that's the case we need even now. We need epidemiologists who are trained. We need Center for Disease Controls with doctors and epidemiologists who are trained to look at these issues, and IT can be a backup support. But in India, we are witnessing the reverse. We are seeing the response is being, at some level, is being led by people who are technologists who are saying that we use technology to solve all problems. Well, that's where we are at, and I'll let Riddhi take over and let you explain what's happening with the with the Aarogya Setu app.
Thank you, Srinivas. Yes, I do agree with you that technology can help us, but that alone cannot solve all the problem. And I will just present my findings, what I have found from by looking into the app. Let me share the PDF with you. Can you see the document? Hello?
Yes, Riddhi, you can go ahead.
Yeah, we can see it.
So starting on the top, you can see there are some of the endpoints which have been obtained from the app. So I installed the app and used it as a normal user would. I also went into the code and tried to see what is the logic and what it is actually doing. And these are some of the endpoints which were found hard-coded. The first one in particularly looks a little interesting because that is a protected endpoint. You cannot just access it. It requires some kind of authentication, and on accessing it gives you missing authentication token error. Others are just normal, informative apps with mostly static text, which tries to spread awareness about COVID-19. If you see the next section, hard-coded API, this is a API key which has been found hard-coded in the code. So I'm not exactly sure what it is doing, but most probably it is related with the first endpoint that you see, auth swaraksha.gov.in. Then in the it has root detection in place, and it is following the standard root detection process. If you can see, it is looking for the presence of files and folders which get created when a device is rooted. And uh, it looks like it could be bypassed because it is following a very standard approach. Then there are some good practices also which the app is following. For example, when it comes to cryptography, it is using Google Tink, which is a cross-platform cryptographic library. It is also using shared preferences, but not the normal one. It's using encrypted shared preferences, wherein your key value pairs are also being encrypted. So which is even better compared to the standard approach that is followed. When the app is started, there are certain things that happens. It changes your Bluetooth device name to some value, and then it checks if your Bluetooth is enabled or not. If it is not enabled, it enables it. And once these all things are done, then the app starts, and user is asked to select a language. The first thing that user will have to do is they have to register themselves. How do they register themselves? Your phone number is what is required. So a valid phone number has to be entered. Once you enter that, an OTP will be sent to that number, and you have to provide that OTP. And after that, all it does is it presents you a very simple form which is optional. You can or you cannot, if you don't want, you might choose not to enter any of the details, but you can skip that form. But it will always show you one link wherein if you open it, it again asks you to enter those details. Once you enter your personal details, basic details like your name, age, and such information, once you save it, that link disappears and you don't know where it went. It saves it in your device most probably. And it asks you permissions. One permission it clearly asks you is device location. It asks you to grant permission to access your device location. The second permission, once you grant this, it again, there's a pop-up that shows up, and it says allow your phone to be visible to other devices for 120 seconds. So people will generally think, okay, it is just 120 seconds, let me allow. But I think when you do this, there are many other permissions which are being granted, because unless and until you give this permission, you will not be able to use the app. There is no back button. Back doesn't work, cancel doesn't work. You have to give this permission at this point. And after that, your phone number is validated.
One question, one request from a participant. Could you zoom into your screen a bit, because the fonts are a little small.
Okay. Can we share this document with them?
Yeah, we can. I think we can do that, because if you're presenting from your phone, then I don't think you can zoom in.
Yeah, because
Anand, so just to answer your request, I think we'll just share the document separately. I think that may help, because I don't think we can do anything else right now.
I can, I mean, because anyways, you won't be able to read all the text at this moment, but I'm just showing the sections so that you can refer to them at a later point when the document is shared. Right? So that's
I think you can continue, yeah. Or if you can you make your screen landscape? That may help.
Okay. Yeah.
Yeah, better? So this is much better, because now you can scroll up and down as you're referring to a section.
Yeah. Okay.
All right, thanks, Edu. Yeah. I'm going on mute.
So that's about the app. And then you also have a self-assessment feature wherein it will ask you questions about how do you feel, have you visited any places which is infected with COVID and such. And this is like you can retake this assessment as and when. Now, this is a good feature, but it depends on how people are using it and how much information they are providing. Everything looks very naive, but in the background, it looks like the main purpose of the app is to know exactly the location of the person and who all they are interacting with. That looks like the main purpose of this app. If you see at the groups that this package is mapped to, you will see there are certain group IDs associated with it. Like on the screen, you can see 302, 3003, and 3001. What they mean is this. So basically, any device which has this app installed is capable of creating socket connection with other devices with app installed, and they can transfer data amongst each other. So your data can be sent to the other device, data from other device can be fetched and put in your device. We will look into what kind of data they are specifically fetching and transferring. These are the permissions that are being taken, that are being used. So Bluetooth admin permission, location information, your internet is being controlled, and they're also tracking if so whenever you start the your mobile phone, if you have shut it down and you start your device, on boot itself, the background services will start working and contacting all the other devices nearby. There's a job which runs and does all these things. So these are all technical terms here. If you see, there's an intent which is being used to invoke a broadcast receiver, and it's doing the same thing which I just explained, like finding the nearby devices uh, and storing the details. It also advertises your own device to other devices in the vicinity. Now, if we want to see what type of data it is working at, what type of data it is looking at. So these are some of the tables names which have been fetched from the code. The database name is Fight COVID DB, and the interesting ones are here. User device info table, so Bluetooth name, phone number, and timestamp, exact timestamp when you came in contact with someone else who is using the app. So that timestamp is recorded, and the phone numbers and the device name is recorded. There is also nearby devices info table, which stores the MAC address and how far you were from the other person who had this app installed, and then what is your battery power level, what is your latitude, longitude, and again timestamp is recorded. The user location is basically tracked, and whoever you are coming in contact with, that is being tracked. Now these are all just technical details here. And I think these all elaborate whatever I just explained, just more of technical code that I have fetched from the code base. That's it. So that's all I have, Srinivas. If there's any question, I'm open to take it up.
Okay, so we'll let Srikant continue with some of his own analysis, and then we will take more questions.
Sure.
Srikant, you're up.
Sure. Yeah. So before going into the apps, I mean, Riddhi gave a nice overview of what the app does and what data it collects and stores. But I would just like to bring in some of the other points as to how the app was developed and who developed it and so on. So if you see right from the app's namespace, which has say nic.gov.Aarogya Setu, and it's released via NIC's Play Store account. And whereas the certificate of the app is having from Niti Aayog, whereas in our analysis, we found prior versions of the app which was leaked a week ago before the Aarogya Setu app was released, and that app and this app share the same same source. And it turns out that Make My Trip ticketing company that are actually behind the development of this app. Now, I don't know why this whole massaging of government branding took place and under what context. Whether maybe it's probably because to keep the app alive on Google Play Store, because there was some report a while back as well saying Google has started censoring or kind of filtering COVID apps because there are a lot of apps that have come up, and they want to kind of give it an official color to this app. And why this is problematic is because we had a history of involvement of private sector in the data ecosystem, digital ecosystem, and there have been concerns around data governance, platform governance, and this has been an ongoing issue on the tech policy sector. And this problem exists, say, in platforms such as Aadhaar, UPI, for a while now. and the same will also be at some level. Those problems will be inherited into this app and this platform as well. And then the other comment is this app is not open source, whereas there have been some of the other contact tracing apps that have been open source. Singapore is open source their app, and they do collect far less information while creating the profile. I mean, they don't even ask your name. And whereas here we do a OTP authentication, and then we ask for name, gender, age, profession, travel history, smoking preference. All these are very, sensitive personal data, and this gets databased into this app, which government has it with some private sector involvement, so there are some issues there. And main thing is we don't know how this data is getting used, and we don't even know concretely as to how what data exactly gets transmitted. So while we've been able to make some guesses through some kind of analysis, but we don't have a complete picture of what is happening behind the scenes, and the source code is not available. While open sourcing is not panacea, but it's necessary to kind of have these for us to have some confidence and not have fears, right? And in today's live mint column, Rahul Matan had actually claimed how this is privacy friendly and privacy first, and there's also been a messaging around how this app has been privacy first. And in that article, Rahul Matan mentioned that all the data that is being collected by the app is primarily stored. By data, obviously the profile data does get stored on the cloud, but the contact history data does get stored on the device first. And he had mentioned that how this contact history data itself is anonymized, and you only share the device IDs and not the any personal information of the users coming close to you. But this data too will only be uploaded only if the person is found to be infected. So this he claimed was how this app was privacy first, in the sense that it gives agency to the user and the data is not uploaded. But this claim seems to be false, and we do have a fair bit of suspicion that this app does keep uploading the contact history data to the cloud along with the GPS coordinates. And it is also pertinent to note that another news item that came today afternoon, which said the government appointed expert panel will to oversee the technology platform running for COVID monitoring, will also be monitoring the data that is being captured by Aarogya Setu app, and would use that in deciding how to ease the lockdown situation. And basically, government is trying to use this app and its usage data to kind of have some kind of proxy metrics as to how people are moving around and so on. So which is possible only if the app again shares data back to the cloud, which includes geolocation data and contact history data. So this in itself says that there is an urgent need for clarity on what data exactly gets uploaded onto the cloud and is available for the government. Because while on one hand, Rahul Matan, who claims to be, who says that he has helped the privacy framework around this app, and he's been involved in the app, and he says that only if you're infected, the data is uploaded. Whereas we also hear news which says that government is using data from this app to kind of see and decide on easing the lockdown. Now, the other thing is privacy is not again automatically granted, and it's heavily dependent on security. So I tried doing a security static code analysis of this app using a tool called MobSF. And Aarogya Setu is not the only app that is being put out by the government. There are various levels of government, cities, state governments, police departments putting out apps. And Rohini Lakshane had written a piece in Citizen Matters analyzing all the privacy policies of these 15 plus apps. So I took a list of those apps, and I had done a static code analysis of all these apps. and the results are not really great. I mean, starting with even say Aarogya Setu, which has a security score of 10 on 100, for instance. So I mean, some of these could be like maybe minor bugs or trivial bugs, but it still doesn't give the confidence that some of the basic vulnerabilities that have not been addressed, or probably there's not enough security testing that has happened around this. Now, nextly, one needs to ask what data is exactly shared. So if I am installing an app from a privacy standpoint, what am I actually sharing? So apart from the profile data, which say even one could argue technically, except the travel history part, your common profile data is probably public by now. But you are sharing two pieces of data which is very specific to you. So one is your Bluetooth MAC address that's specific to your device, and that's not going to change until you change the device. Now, Aarogya Setu will have not just Aarogya Setu, on any app which uses Bluetooth for contact tracing and does upload using a Bluetooth MAC ID will have your Bluetooth MAC ID. And an app like Aarogya Setu, which has say 10 lakh installs, would actually be a rich source of a Bluetooth MAC ID database, and we don't know it, and we still don't have a data protection law at this point. And like if that data gets leaked, which is again another pristine set of data that you've probably not gone outside into any large databases, because remember, you don't actually give Bluetooth admin permission to a lot of apps. So you use Bluetooth with certain music apps or whatever, you won't actually give Bluetooth admin privileges to all the apps, and they won't probably have the device identifiers as well. Whereas as against this database will have this Bluetooth MAC ID. And so, I mean, this potentially could again be and we've seen the government also having some kind of weaker privacy thinking on data itself, and we've seen the Vahan data being sold off. So you never know next budget shortfall, or even for the COVID relief, you just sell off Bluetooth data to industry who may have it for very different use cases, and they say that we are kind of selling this data as well. So that's the other thing. Yeah, that's all I had, Srinivas.
So we're going to open up for questions, but what we're trying to essentially arrive at is that there is a lack of trust in whatever the claims that the government's making, and we can't verify all of it. We can verify some of it by using some analysis and reverse engineering of these apps, but end of the day, it's a black box, because once the data is collected, we don't know what the government's going to do. I mean, you can't really expect that the terms and conditions are great while all the government was required to do is bring rules under the Epidemics Act, probably. Technically, it's not even being done using age-old governance practices. They are actually releasing an app and trying to market it like what corporate firms would do. And there is a new term for this when a surveillance company actually builds some of these apps. It's being called Corona washing, like open washing and whitewashing. So, and we have some of these surveillance companies which have been building them, like Pixel AI, Face Tagger, MyGate in itself. Some of these companies who are directly involved in facial recognition surveillance and surveillance capitalism. Stating that, I'll open for questions. We have some of them already. I think I can ask them for Riddhi actually. This is from Ganesh Kumble. Is my PI stored remotely? Will an IC be responsible for any data breach? He says how to ensure that the heat map generated in the app is not used for state surveillance. Maybe you can answer about the PI store. Is the personal information stored remotely?
I think the registration data is obviously stored on the cloud. So when you sign up your registration data, which includes your profile, name, age, gender, profession, travel history, smoking preference, and the survey that you take on basically like, are you feeling feverish and so on and so forth. All those are kind of stored on the cloud. So that's, and if you actually strictly see that, that's actually health information. So and we don't even have, say, uh, DSHA in place, or anything surrounding health information and privacy around, not just the generic data protection. Will NIC be responsible for any data breach? So we can kind of say this, but in practical terms, nobody is going to be responsible. So that's. So the location history is first stored on the SQLite database, which Riddhi shared. So, but this is where we've got like the conflicting versions. So while Rahul Madan in his piece says that the location history will be uploaded to the cloud only if you are suspect of having the infection, uh, we are not quite sure on this part, because the app does keep storing the location history on the SQL database first, but we do suspect that it also uploads to the cloud. So and it's also possible because the other side, we've heard the other news story which said government is also using this app data and trying to use it as some kind of proxy to assess the lockdown and movement requirements of people.
We have one more question. It says, since the app is using raw SQL statements, would it not be vulnerable to SQL injection attacks? Riddhi, you are muted yourself. Can you unmute yourself? Sorry.
So it's using the room persistence library. So it's like parameterized SQL queries. Now, SQL injections do happen in these cases also, depending on how it has been implemented. But they are making use of room persistence library, which reduces the chances of SQL injection happening. But then how much is possible, how vulnerable it is, that can be known only when you do an active pen testing of the app.
More questions about apps from private party developers, example MyKate. What are the data ownership rules and privacy policy around there? And also wanted to extend one more question from Sharan Sarwagya. Where you able to find all the personal data of an individual is shared with other individuals?
Well, it was we were not able to install the device on a rooted device. We can get the fetch the data of an individual only when we are able to install it in a rooted device. So root detection is in place. So to know how much secure it is, again, an active pen testing would be required, which we have not done. It's like whatever data was easily accessible without actually breaking the app. We have looked into that, and from that, the analysis has been presented.
Question to Riddhi from Karan Saini. Were you able to discover any exploitable weaknesses in the app? If not, are you aware of any other discoveries? Same question to Srikanth.
Srikanth, you want to go first?
Yeah, the code is obfuscated, so it's non-trivial in analyzing the reversed app. So we couldn't find any obvious exploitable weaknesses. I am not aware at this point of time any such discoveries as well.
Yeah, so regarding exploits, again, I would repeat myself that we have just looked at the static code, and how much it's exploitable, that can be known only when we do an active pen testing. However, there is a WebView which is being used with JavaScript enabled. Whether it's exploitable or not, I'm not sure. But generally, there are chances if JavaScripts are enabled and WebViews are there. There might be possibilities, but it's not sure.
There's a question on how was the static code analysis done. Can you answer that?
Yeah, so using the standard tools, there's Injadify, JDQuery, and reverse engineering tools. So using your Android Studio, you can just look into the code, and it was not easy. As Srikanth said, it was obfuscated. So you had to spend some effort in understanding exactly what it is trying to do. Yeah, and then the standard MobSF tool also was very useful in understanding some of the logic.
There's a question by Sridhar on how will a potential patient will be marked COVID positive? Like, how will the updates that one individual is vulnerable and one needs to probably go quarantine or probably go to a doctor happen?
That's a very good question. And everything revolves around it. So one thing is wherever users are asked to enter details, there is assessment which can be taken periodically, repeatedly, any number of times. One thing is if the user enters the data correctly, of course, that data is going to the government, and that might be helpful in identifying who exactly is affected. But then, are we really sure that people will enter correct data? And how many people are using the apps? Uh, how many? I mean, there are a lot of questions around that. So what we are sure is that if you have the app installed, your location details will be shared, will be known to the government, and whoever you are coming in contact with, that will be known. But the accuracy of who is affected and that we are not sure.
Okay, I'm gonna take a pause for the questions. I'll come back to them. I'll compile them. But I have Hari Pillai. He's been involved with the GovTech Singapore, which was involved in developing Singapore's COVID app, which they intend to open source soon. I want Harish to share his experiences on developing their application in Singapore.
All right, thank you very much. Okay, I did not develop a single thing. It was all done by GovTech, and I've got nothing to do with GovTech other than trying to help them out. I am actually, just for full disclaimer here, or full disclosure as well, I work at Red Hat here in Singapore. And the GovTech had created they have been working on this for about 2 months. And they eventually, nailed the protocol, and they're calling it Blue Trace. So if you go to bluetrace.io, that's where the protocol is described. I'm not sure whether they have updated it. So they launched the app that runs on Android phones and iPhones on the 20th of March, and essentially is using Bluetooth. And with the minimum amount of data, the protocol is all defined within the Bluetooth Blue Trace protocol. I can certainly explain the protocol, but I think more importantly, when they launched it, there was about 500,000 downloads in Singapore itself. And the 2 days later, on the Monday, the minister who's in charge of GovTech, he announced that they're going to open source it. So as soon as that was done, I reached out to him and said, I'm more than happy to help them to do it the right way. And then he connected me through the GovTech people. I know the people in GovTech, but I wanted him to do the loop around so that they are aware that he's involved in the equation as well. And so I reached out to them. And so essentially what has happened here is that it'll be launched. Actually, it's going to be launched tomorrow, 9th of April. We are open sourcing the entire client side, which is the Android and the iPhone version of the code, plus the server side, as well as defining what the Blue Trace protocol is. And this will be an open source project that is going to be on the GPL version 3 license. And there are 5 community members in Singapore who will be, for want of a better phrase, steering this project for the future. So GovTech is essentially forked what they have created. They call it Trace Together. And this open source project that is pushed out will be known as Open Trace. And Open Trace will be the upstream of Trace Together. Trace Together is going to be, they're going to call it the reference implementation that is operational. And the Open Trace will be the reference implementation of a functional code that is already deployed. From there, anybody and everybody can, do what you do with an open source project. fork the code and all that. And we will have a bunch of technical people from GovTech initially, the initial leaders in the various code bases, to be on the technical team, so that they will be the ones who's probably going to gate on the pull requests that will come in potentially. But at some point we need to transition them out to somebody else, because they are needed to continue with the work that GovTech is doing with Trace Together, so that, you know, otherwise they got too many things to do, and what Trace Together is doing has will take a higher priority once this is opened up. So that's the, you know, thing that I think I can share with you right now. And like I said, it will be open source tomorrow. It was supposed to be today, but we wanted to do a little bit more work and finish it up. I hope it's all done, and it will be released tomorrow. And happy to take questions if you have any questions. I am more than happy to explain how the protocol works as well.
Thank you, Hari. I'll continue with the questions, and if there are any questions, I'll direct them to you. So I have questions primarily on the whole 6 feet distance and proximity, especially on how does the Bluetooth proximity measurements work, right? How is the accuracy of GPS and the range? There are multiple questions on it. Riddhi, can you answer that? But especially on how accurate the phone's Bluetooth and GPS sensors are?
Yeah, so latitude and longitude, as I mentioned right earlier, that every individual's latitude and longitude is traced continuously in short interval of time, and from that itself you would know how far you are from the other person, and that's how they know if you have come close enough to the person to contract the disease, and should you be put under quarantine, and to make any such kind of decisions. Was there a safe distance maintained or not? It's all calculated possibly from the latitude and longitude information.
And if I may just jump in here, there is a deliberate decision made from an architecture perspective, and as well as privacy perspective, that we will, for Trace Together, or Open Trace for that matter, the upstream project, will not have anything to do with GPS. It's purely Bluetooth, because what you want is very fine granularity. You just want to know who passed by you, who was next to you within 10-meter radius. And GPS is not going to be helpful at all for something like that, because this is not something that is long distance. This is something that is very within your circle, you know, and since Bluetooth is a 10-meter radius, again, the radius is one part of the story. There's also the element of what is the signal strength, because that's the other thing that this will also detect. How strong was the signal, so that you know how close you are to between the two people who have Trace Together or Open Trace running on their phones.
Yeah, I think Harish, you're right. They
are.
Sorry, yeah, go ahead.
Yeah, so I'll just add, probably I'm thinking loud as to why they also kind of insisted on GPS is probably because they want to try some kind of containment or an extended lockdown for that portion of zones where they know that an infected person has traveled. That's because probably we still don't probably have a high testing infrastructure to test whoever the person has come in contact with. So they could probably use this data and then say, use this region is now in containment, which is be an extended lockdown for that particular region. It could be a set of localities in the city or so on and so forth, so where this person has traveled. So that's probably the reason, or one thinking around also storing GPS data and tracking GPS data beyond the Bluetooth.
So what I would say, adding to Harish, what he was saying, I totally agree. So I was not able to relate because I had been looking at it from a technical point of view. So they are tracking the signal strength, and the Bluetooth is being used very actively. So when someone comes into proximity, probably from the signal strength, they know how close that person are, right, Harish?
Yeah, that's the idea. So the idea here is the RSSI to be captured by the device, both devices, so they know how close they are, firstly. Secondly, there is a timeline, there's a timestamp to that. so that you know how long you were close by. If you're just walking past, it's not meant to be an issue. But if you're standing around and all that, yeah, that's when you want to try and track it. So that's correct. So
actually, now the data makes sense. What I had seen in the DB, after your explanation, it does make sense what you're saying.
Yeah, I mean, I'm happy to explain what's happening, but the Blue Trace protocol will be published tomorrow as well. So you're welcome to read it and do whatever you want, but I'm happy to talk about it. But I don't want to, dominate that for this conversation.
There are a lot of questions actually. Can this app efficiently do contact tracing? Hari and Srikanth, both of you can probably answer this. Can this actually work, both Indian experiences and what's happening in Singapore? And there are also questions for Trace Together. Is any government authority outside the Ministry of Health in Singapore allowed to access any data like phone number, permanent anonymized user ID, which is stored in central servers? Can this information be used for anything outside epidemiological purposes, say for law enforcement?
Okay, shall I answer that? Okay, I'll answer that part first. No, this one is purely and only for Ministry of Health, the Singapore Ministry of Health, and only they have the key for that. And this is purely for the purposes that we have just discussed. The data that is being that you will be in the phone as it gathers as you walk around and come into range with other devices is only valid for 21 days. So there's a 21-day delete that happens on the phone. So after 21 days, it's irrelevant. The data, because I think it's useful to understand as well, what is the data that is being captured? There is an ID when you first register with Trace Together. And I quickly walk you through that because I think it's useful to understand what is actually being captured. When you load up the app, you would be asked, there'll be a bunch of questions that, ask you whether you're okay with doing this. And then you'll be asked for a phone number to send an SMS to. So you punch in the phone number, you'll receive an OTP, and you enter the OTP, and that's when a unique ID is created between that particular instance of the phone number and the Ministry of Health. And that information is encrypted, and there is another, what is called a kind of like a 15-minute temporary ID that is also attached to it, encrypted, and that is sent back to the phone. And that is your ID for that purposes. But the thing is, it's an encrypted one with the public and private key infrastructure. The private key is at MOH, and you only have the public key. So that is the only thing that is stored. And so when I come across another person, that string of who I am, who this particular device is the only thing that's exchanged between the two phones. And so over a period of time, you accumulate in your log a sequence of contacts that you have made. Now, should one of the persons get into a COVID-19 situation, they would, when you go to the hospital or something, they will have to authorize the unlocking of the phone as an individual. I will have to unlock my phone, and then a authorized person from the Ministry of Health will be there, and they will provide me with a number, and I would have a number on my phone. Those things have to match. It's like a kind of an unlocking mechanism. If not, that information is not available. I'll unlock, and then that information that is in my phone, the logs, are then sent over to Ministry of Health. And at that point in time, all they have is a string of encrypted information. They will have to decrypt it because they have the private key. And only after decryption will they know what phone numbers they are associated with. So the phone number is not within the information that is actually stored in individual or provided to every individual phone, which is also, after all, encrypted. And then they will determine at which point it becomes a very manual process. They will do the necessary trying to figure out where are we, when was this particular contact? Was 2 weeks ago? Maybe no big deal. Or it was 1 day ago? Okay, maybe I need to contact this person. And how close was this person because of the RSSI, looking at the signal strength, and so on and so forth. So they will be able to do that kind of next level. That's a human in the loop system to figure out, then they do the calling up and making a decision from there. Any and all of that data is purely only for this purpose. And at any time on the phone, I can just go ahead and delete it. And when I delete it, it's also deleted on the server side, and that's it. It's all gone. All the trace data is all gone.
So you're actually letting an individual delete all of his data.
Yes, that's correct. I mean, as a yeah, if I have access to my phone, I can delete it on my phone.
How can that be verified? I know that it's the idea that when you press the delete button, it will be deleted, but is there a mechanism this can be verified?
Well, the source will be tomorrow. You can have a look at it and have a look.
Thank you. And there is one more question. Would you know how reliable the Bluetooth proximity is there when there are obstructions, apartments, for example? Say you are in your apartment and your neighbor is in his apartment, yet your Bluetooths are connected, but you haven't passed across with them. Then this could mean that it's a false positive. Are there scenarios like false positives and false negatives?
I think this is definitely a possibility. That's why the need for human in the loop kind of a scenario has to come in. So all I'm going to have is I have no idea who's around me. I have no idea. And all I know is my phone picked up a bunch of random IDs. And only when there's a situation that gets, and I'm not the one who's going to be looking at it. It is going to be the health authorities that is looking at it. So once they look at it, they decrypt it, they figure out, they call my neighbor. Okay, so my neighbor is aware of it, but because it could be because the walls are thin enough that the signal goes through, but chances are that's not going to be an issue because we may have been completely separate anyway. So I think those are the things that they have to do when they get into that scenario where they're actually doing the calling up and figuring out whether there is any potential for exposure.
We have one more question related to the Indian app, Aarogya Setu. Is what are Indian government's policies on data retentions? How long is this data retained? In fact, Srikanth, if you can answer this, can we actually demand the government to delete our data after all of this gets over? Or say I get tested positive, then I'm cured. Can I ask them to delete it?
So I think they said that the data will be residing for 30 days and probably rolling over 30 days. But we on deletion of data, I mean, we really can't say now because they have included a clause which says as deemed necessary or something like that in the privacy policy. So they can always say that we would want to use this for analysis, some kind of research or whatever, and then keep the data as, I mean, and they could still then say that this is anyway anonymized data, so there's no personally identifiable data that we keep. So that's on the deletion of data and demanding for deletion of data.
Okay, there's one more question to Hari. Are the IDs refreshed frequently or are the IDs bound to the phone number? Say if I change my phone, do I get a new ID?
Yeah, you should be getting a new ID. But on the other hand, yeah, when you flush the stuff from your phone, yes, you get a new ID. But the important thing to remember is that the ID that you get is not tied to the phone or whoever receives it. There's only one place where it is kept. The mapping is only in the Ministry of Health Systems, and only they have access to that bit. And that's the only individually identifiable information that there is. Not even, there's nothing else. There's no geolocation, no nothing else.
We have one question by Malavika Raghavan. What is the thinking on the most relevant data points for the objective here? That is, I understand is for identifying and for contact tracing a COVID positive person, and therefore your risk of contact tracing. Like, what is the minimalistic amount of data would one require? Like, what all data how much minimal can the data tracking be done, and how much is actually Indian App Store? Harish, can you actually talk about how minimal can we go, and maybe Srikanth or Ritik can talk about the current app?
Could you repeat the question? I mean, what is the minimum? What was it again? Minimum?
What are the minimum number of data points that you require, say, to identify your network where if you're positive and you want to identify whom all you have been in touch with. Like
Okay.
Indian app is collecting GPS data, what the Singapore one doesn't.
Yeah.
So how low can we go in terms of data minimization? What would be the say bare minimum one can ask?
So basically, when you have a contact that is logged in your phone, what that tells you is that there is a person at a certain distance and at a certain time that was near you. That's it. Then what they could do potentially is when it's decrypted, they figure out, okay, there's this particular phone number and this was at this time, and is there anybody else around it? It could be that, that might be a person who has got a relative or somebody who may not have something else, may not have the phone, may not have some device that is enabled for that. So when they do the call up, when they call up the person whose phone was close to mine, they can then do the determination. Say, okay, we think that, what conversation they have, I don't know, but it will be decided based on asking them, we notice that you may have been potentially exposed. Do you think there will be somebody else as well within your circle? That means this is now one level away from me, right? So that is entirely dependent on the human communication, because that is a very intensive conversation that needs to happen. And that is done by the contact tracing people who are doing that at the Ministry of Health.
Srikant, can you let us know how much, Srikant and Riddhi, can you let us know if we can minimize the amount of data collection that is being done through this app? Do you agree that this is good? It's actually minimum, or is it actually excess?
I think the Bluetooth one is probably the standard things that have carried across different countries. But I think, we need to see the other side as to see why they would probably be also tagging geocodes. And that's probably because we also have a low smartphone penetration, or probably the highest smartphone penetration is still about like 400 million. And it might not be the case that not everybody still uses these apps, and they would probably want to have some kind of information as to where this person has traveled, at least whoever has smartphone and has this app installed, and then use that piece of information to do some kind of containment. Because they probably also, again, even for this app to kind of work and be effective, you need to have a minimum volume or threshold to get the network effects and then have everybody in. So this app will again be efficient only if everybody who's going out is also having it. So if you just go out in the city and you are the only one having this app is, the data that this app is generating is basically useless, right? So I think in that context, they probably added the GPS. So we don't know, but GPS also obviously adds into the surveillance spheres, where it might be on the other hand seen as excessive data collection.
We have one question from Siddharth Dev. Oh, sorry, Riddhi, do you want to add?
No, I agree with whatever Harish and Srikant have said. Totally. The other information that is being asked when you are registering or in the assessment, they are all optional. They are not mandatory. But what is mandatory is enabling the Bluetooth and giving all the permissions that they ask for. So it looks like they are more interested, the government is more interested in knowing if the people are coming close enough, and to avoid they're not coming in close contact. That's the main intention. It looks like that's the interesting data that they want to collect.
There is a question from Siddharth.
Can I just add one bit here about the GPS portion? One of the challenge with GPS is when you are supposed to be in the house, you're supposed to be at home, you're supposed to be wherever you are supposed to be. You're inside a building. And at which point the GPS granularity becomes useless, because there's 10-meter radius or whatever in a building, everybody is in the same place. So you really cannot discern who is where. That was the logic behind why the GPS portion makes no sense from a design perspective of BlueTrace.
Yeah, just to add, I think here the GPS perspective comes more from a concept of lockdown and containment zones rather than individual contact tracing. So the GPS is kind of more used as which areas do we mark as containment zones and so on, and not say for individual contact tracing.
That's more from a policy decision point of view. Okay, so there's one question from Siddharth. It's more on the what if you are alerted that you were in close contact with the infected person. Then do you have to go report yourself to the Ministry of Health, or do they come to your house? How does this work, considering they probably don't know where you're actually living?
Well, should I go ahead?
Please. Yeah.
Yeah. So there is something they are also doing, and the app also does is send you push notifications. So if government thinks that you are infected or you are vulnerable in any way, or if for whatever reason they want to communicate with you, they can send you push notifications and tell you what you need to do.
So there will be instructions from the government, and if they can't identify, they'll try to trace you.
They have capability. If they want to use it, they can use it.
I think this is where, just to add on, this is where some of the other state and city apps, they also have even far more granular activity controls where you have to send in selfies at periodic specific intervals of time and so on and so forth. So, I mean, those kind of functionalities could also be plugged into this app as well. So, you never know.
There's a question whether there is any instances of these Bluetooth apps actually being successful. Do they actually help solve the issue at large, or are there distractions?
Only time will tell.
It's an experiment, and you just have to wait for the results.
Yeah, that is correct. I think the one of the things that even from a Singapore perspective, we are not even 21 days into the launch, since the launch of the app, and we want to make sure that the data is actually being erased. That is 21 days older, 21 days and older. So we are just, I think, coming up to 21 days by the end of the week. So we'll see what happens. But the code will be something that you can have a look at and play around.
I guess that's it. We tried to answer most questions. There's one last question, I guess. Who all has access to the data generated by Aarogya Setu app, and at what stops interdepartmental sharing does it happen, and what data points are being shared? Is it shared with the police? Because we also see police are going door to door sometimes when individuals are being asked to be quarantined.
So if you read the terms and conditions, so it says that the data is being shared with the government, but if need be, if there is certain situation where data is required for legal purposes or any other purposes, then it might be shared on a need basis. So I think terms and conditions could be elaborated. They're not too elaborate, and they do leave room for confusion, and a lot of guesses could be done. So yeah, I think that's one area where it could definitely improve, so that people know exactly how the data is being used, under what conditions, what could go wrong or what could happen.
Thanks, Reddy. So there are a lot of claims that the Indian government is making, but most of them can't be verified. I think I've already mentioned that. But the main problem is these apps do not work without the human intervention, the human side of it, and that's something which is already missing in terms of an actual healthcare response, because you're seeing lack of protection equipment for the doctors to actually go to the response. So will these app help? I think they can be a good addition if they work fine, but at the end we have to accept it. It's an experiment and it could fail. But the problem with the failure is, does it mean that individuals who have this app actually venture out, hoping that if they actually go meet someone uh, who is positive, they will be informed so they can take care of themselves. The issue is actually how this information will be used by the government to essentially let the population move. And I think the Indian government has to answer a lot on that perspective. In this regard, there are a bunch of concerns that tech communities across the world have, including the Electronic Frontier Foundation in the US, the Chaos Computer Club in Germany, who have been sharing various reports and how to evaluate these apps. We will be sharing some of the material that was discussed in the call today, post the call. And I guess once we have the open case app source as well, we will try to share that and probably allow you to reach out to Hari and probably get you more detailed explanation of the protocol in itself. At stating that we're going to end this call, it's, I guess, and okay, one last question. There are a bunch of questions which were like, oh, can we use blockchain to solve it? Can we use something else to solve it? I think what must be understood here is it's a healthcare problem, and technology can only aid in solving this, provided there is a healthcare first response. It can't be a technology first response, and I guess that's what most of the technologies around the world are saying. So any new technology, except unless it's a vaccine, I don't think it's going to completely help out of the box. Anything else that you want to add? Closing comments, each of you?
Sure, let me just go ahead. I thank you for the opportunity to speak, but I think I just wanted to highlight, mention that putting any kind of technology solution is not, as you rightly mentioned earlier, it's not the intent here. It is to solve a very, very critical and highly urgent problem. Anything else it becomes an overkill. And just to speak the specific thing with blockchain, the problem, even with this Bluetooth, you need to make sure that the power consumption is managed. You need to make sure that's, the encryption that needs to be done to send the signals, send the IDs across. You don't want to suck into the power, the budget of the phone. So you need to make sure that you have enough capacity and the phone still works reasonably well. So many trade-offs that happen. So you have to minimize what you can do and work within the parameters that we have to set ourselves under. And that's about it. Thank you.
Riddhi and Srikanth, do you want to add anything and end?
I think Delhi government seems to be taking steps which looks like a sensible thing. So they are not depending totally on the technology, but they are making very clear that what has to be, they're taking steps. And I think that should be expanded to entire country. That what is the plan? Now that the app is out there, app alone, as you rightly said, technology cannot solve problems on its own. So app is out there. It is there to help all of us, and we are ready to be part of it and to help the government. But then we don't want to be a victim of doubts, and we don't want government to just scare us and try to impose something which we do not understand. They should also tell us that what are they going to do with this, and what medical solutions are they going to provide in addition to this. So Delhi is setting a good example in that front.
I think I'll add to that and say, like all technology governance issues that we've been facing in India for a while now, this too needs some kind of community participation. I can understand that this app was probably developed in a very short span of time, given the crisis, but it probably, we can give. I will take this opportunity and say the community is ready to work with the government, and we can see middle points, and we can together solve these challenges. The app probably will have. They can open source it, and they can have much more contributions to it, and so on and so forth. So, we need to see how we can, for the short term on this app, for the purpose of this app, even if it's a technological solution, because given that, software engineers are not going to invent vaccines, software engineers can still do things that can help things around on this solution space itself, and government should probably try and engage larger community and propose solutions than do some kind of central planning with a closed set of doors and limited set of people.
Can I just add one more thing here? I just remembered.
Sure.
One of the design factors behind OpenTrace is to be able to help create a federated tracing system between accredited health authorities. So if somebody is traveling to another country and you are using, that country's app, when they exchange data, they should be able to send it back to the respective country. It says, oh, this particular person from the other country was here, and the data format, you decide how the data format. All I know in that data format is this one came from a particular country, and this is the authority that issued it. And so between the authority to authority, they will do their own authentication and sending the data across so that it goes across the world. It's not just in one country alone. So this could potentially work in parallel if the Indian government chooses to want to also implement something like this.
When you make it an international standard, that sounds good. So there were a bunch of more questions. I'm sorry, I'm not going to answer them, but I leave it as a question itself. All of this is bringing questions on data anonymization, data sharing, data accessibility, a lot of questions on data and a lot of questions in technology in itself, not just healthcare. We can discuss, we can help you understand more about this. So we have a Slack channel that a bunch of us hang around with. It's on the site friends.haskeep.com. You can just access it, and we will just hang around, and we can potentially look at more apps over the future days. Well, it's the basic set of analysis that we have right now. We will try to see if we can get more such discussions happen. We will take leave for now. Thank you all for joining.